Because even when you bring a pet to the veterinary clinic, something, you see something like really wrong, clearly, for example, cat is sick, the doctor still will have to question you about the animal. Why? Because when you bring a cat into the clinic, the cat will behave either super agitated, or it will be depressed, it will be scared, so it will react abnormally. And the veterinary doctor has to be super skillful in order to tease out, to understand what is, going on with the cat. Or they'll have to order a whole battery of different tests, MRI images, X-ray, blood tests, and so on. So really, you are the main expert. And what you'll be doing is that you'll be just observing the behavior. For example, any animal, when it's just getting sick, getting ill, it will become more quiet, less playful. Sometimes it will go and hide. You have to go and look for it. Why? Because it's instinct of the animal. It will go and hide in some dark corner. Why? Because it's avoiding noise, it's avoiding exposed places. Instinctively, it will seek a protected shelter and crawl there and try to rest and until it gets healthy. So, or for example, you can see it's not eating well and so on. So just observe the animal, and as soon as something is really going on, you suspect something is off, you can already apply coMra therapy. And this is the beautiful thing about coMra therapy, is that you don't have to know the exact diagnosis. You are not afraid to apply the device because remember, in coMra Delta, in coMra Palm, the radiances, the energies that we use in the device are really low intensity, and you will not harm the animal. In the worst case scenario, if you put it on a healthy organ, simply nothing will happen. Nothing bad will happen. So, and this is one of the problems that a veterinary doctor will see, is that typically they will bring animal to the clinic and it's already really, really sick. The disease already advanced, and it's more or less emergency situation. So with coMra therapy, your focus really should be on preventative approach. For example, some breed of dogs, let's say a Labrador, and I'll show an example later, or some bigger dogs, they would have problems with the joints, with the hip joints. Some cats have heart problems. We also know that, for example, as the animal will be aging, it will be prone to other diseases. Other situation would be, for example, when you need to take your, let's say, cat for a vaccination. And nowadays, unfortunately, require these new vaccines coming on the market. I know for a fact here in Russia, not all of them are well tested in terms of their toxicity, and they might have serious side effects. So what you can do is that you do some universal treatments in advance. Let's say 1 week in advance, you do universal treatment. I'll talk about them later, and you can prepare the cat, for this immune attack or immune load in a system when the cat is vaccinated. So basically, you can really predict when something is going to happen, or especially if animal is already old and it has chronic disease. Again, you don't have to wait until the animal is really sick. As soon as you see something off, you can do general well-being universal treatments, and it's much better approach. So don't delay treatment. It's really important.